Alright guys, let's get busy talking about nicotine. We're going to start out by talking about our presentation here. Now, presentation is going to be not incredibly high yield, but you're going to see things like cravings, perhaps a patient who has a history of vaping or cigarette smoking, perhaps they're actively smoking or vaping in the vignette. This is not super high yield, but essentially someone who is using some type of nicotine product. Now, largely the questions are going to revolve around withdrawal. So this is where we should focus in our energy. So we're going to see restlessness when it comes to patients who are on nicotine. So we're going to see restlessness in patients on nicotine withdrawal because they're really craving that next hit of nicotine. It's highly addictive, and so they get very restless when they don't have enough nicotine in their system. Additionally, you're going to see this in the form of irritability. So when patients aren't getting the nicotine that they want, they're going to be easily upset, they're going to be very irritable, they're going to have difficulty concentrating, as well as an increased appetite. And they have an increased appetite because nicotine is an appetite suppressant. So as they're withdrawing from nicotine, they're going to get an increased appetite and start eating a lot more. Now, let's talk a little bit about the management here. So we can use nicotine supplements like gum or lozenges. And this is a good option because the nicotine that we classically find in cigarettes is no different than the nicotine that we find in gum or lozenges. However, the nicotine in the gum and the lozenges is just pure nicotine. We don't have all these dangerous tar-like harmful lung chemicals that are hurting people when they're smoking. We're at least taking that out of the equation. Yes, we're still kind of fueling their nicotine addiction, but perhaps we can start tapering them down, setting them on a schedule to get lower and lower on this pure nicotine that's not as harmful as cigarettes. And this drug works specifically on nicotinic acetylcholine receptors. And what it does is it goes ahead and sits on the receptor and it provides the patient with some partial agonism at that nicotinic receptor. So they are giving the patient a little bit of what they want, and it also prevents all other nicotine products from taking their effect. So if a patient is on varenicline and they choose to smoke a cigarette or have a vape or eat some nicotine gum, that nicotine is not going to be allowed to sit in the nicotinic receptor because varenicline is taking its place. So you can think of this as analogous to buprenorphine when it comes to opioid management. This is giving them some partial agonism, but preventing them from having any other agonism from stronger nicotine products. So this is really great for reducing cravings because it's not reinforcing any of their other use of nicotine products. We can also choose to give patients bupropion, and this is a great choice on test day for a patient who has both major depressive disorder and is trying to quit smoking, because we know that bupropion is one of our atypical antidepressants, so it's a great choice for patients with major depressive disorder, and it has benefits of helping people quit smoking, and it does this by decreasing NET and DAT activity. And the NET is the norepinephrine transporter, and the DAT is the dopamine transporter, and so you're basically keeping more norepinephrine and more dopamine in the synapse, and this makes people feel better, and it also allows them to quit smoking more easily because they have some of these chemicals in their synapse that are making them feel good, and they don't feel the need to reach for cigarettes when they're feeling depressed or anxious. So this is a great choice on test day when you have a patient who you need to choose an antidepressant for, and they also happen to be a smoker. This is going to be your go-to. The thing to make sure here is that they don't have a history of eating disorder or seizures, because those are going to be contraindications in our patients who want to take bupropion.